Well, joining me now for more on the future of health care legislation for the country's best political analyst, Kellyanne Conway. She's Republican pollster and strategist. Good to have you with us. Kellyanne, president and CEO of the polling company. Jeffrey Plaut, who is Democratic pollster. Good to have you with us, Jeffrey. Joe Conason, columnist, Salon.com. Joe. And Matt Lewis, contributor, politicsdaily.com. Matt also writes for townhall.com. Good to have you all with us. Let's start with the public option. Let me ask you, Jeffrey, this way, if I may. What is the difference between an opt-out public option, a competitive option, a consumer option, and, say, government-run health care?
Right. Well, the public option is supported by 57% of Americans, and so it's not yet supported by 60 United States senators. But an option is something which is, in the lexicon of American politics, is popular, and this current option is popular. But it's the healthcare obviously is kind of split view between the parties. But the public option is much maligned, but better thought of by the country than it is. So,
Kellyanne, with 57% support for the public option, why in the world would Harry Reid, Nancy Pelosi be playing with other, derivations, opt-out public option, competitive option, consumer option? What's the problem?
Well, surely they must realize that polls that ask Americans, do you support or oppose a public option, are incomplete, because most Americans are confused as to what that is. And I don't blame them, because most senators seem confused as to what that is. The public option is just another fancy way, a sanitized way, really, Lou, of saying what would be a government-administered plan. Even Senator Tom Carper, a Democrat of Delaware today, said that he would support a public option if it were run by a nonprofit board and if the taxpayers didn't pay for it. That's hardly the public option, I think, that Nancy Pelosi and others have in mind when they say public option. Asking people if they support or oppose a, quote, public option is asking like if they support world peace or no rain on Saturday. It sounds good.
Well, adding the public option, Senator Reid, the majority leader, lost the support of Olympia Snowe. Also, Joe Lieberman today. Let's listen to what he had to say. Well, we don't have Lieberman, so I will just turn to the fact that you lost, Joe Conason. Senator Reid lost. Joe Lieberman. What is the future, and why is Reid pushing? I'm sorry?
I doubt he ever had Joe Lieberman, and the reason is very simple. Joe Lieberman has been a creature of the insurance companies and the pharmaceutical industry for 20 years. His wife worked for them. She was a lobbyist in all but name for Pfizer and for Hill & Knowlton, which is one of the biggest lobby shops in Washington. So if they were ever counting on Joe Lieberman to help them with this, they were making a big mistake. I'm sorry?
Olympia Snowe.
Well, Olympia Snowe in Maine, the public option is quite popular. I don't know if it's more popular than Olympia Snowe is, but it is very popular. Now, I wouldn't necessarily count her all the way out until the very end. And the question really, Lou, is what do they do in the filibuster? This is what Lieberman did today, was to say that he would vote against cloture, which is a huge betrayal of his own party, by the way. He promised he was a Democrat on everything except the war in Iraq when he ran for re-election, that he would follow...
I'm sorry, who's betraying the Democratic Party?
Joe Lieberman, who told voters in Connecticut that he was a Democrat on all the issues. He was a liberal Democrat on all the issues except the war in Iraq. And it turns out that he's beholden...
The same Democratic Party, by the way, which rejected him.
Well, the voters did,
they supported Ed Lamont.
No, except that the Democratic Party in Washington allowed him back in and let him keep his seniority, and he made promises to them, which clearly he doesn't intend to keep.
How do you explain Mary Landrieu, then?
Mary Landrieu's not from Connecticut, so that's a whole different thing. But I'll tell you, for many Democrats, any Democrat who supports a Republican filibuster against this bill is not much of a Democrat, and they're going to suffer for it.
Suffer, pain, punishment.
Lack of contributions, lack of support within the party, and problems when they run for election.
That's probably why Harry Reid actually came out in favor of this, because he is under intense pressure from the very people that are threatening votes, the liberal blogosphere and the unions. They want the public option, and that's probably what has pushed Harry Reid into coming back in favor of something that we all thought was dead a couple weeks ago.
Well, they don't have to vote for the public option, Lou, but what they do have to do is not support a Republican filibuster against a goal that Democrats have had for 40 years or more. That's a place where I don't think any Democrat needs to go unless they're really willing to court extreme anger within their own party.
You know, Lou, if the public option went to the ballot, which it's obviously not, to America got to vote on it, it'd get 55% or more. In the United States Senate, it obviously would get 55 United States senators or more. The whole issue is the number 60. 60 is a big number and one to get passed. So we're kind of
60 is what you have, Jeff.
But if you ask the American people, do you favor $1 trillion in federal spending? Do you favor $500 billion in new taxes? Do you favor premiums going up? They would say no. And that's really what a public option does. And let me tell you, we're going to have Republicans win in Virginia. Right now in even New Jersey, there's a tough gubernatorial race. I really think if I'm Blanche, Lincoln down in Arkansas, or Ben Nelson, or even Mary Landrieu, I'm not sure that I want to go and support a public option and then campaign as a blue dog Democrat back home.
And the opt-out is a canard because if you really want to provide an opt-out, allow small business owners to opt out. This administration's policies have been an assault on small business owners, believe me, or allowed seniors to opt out of the $500 billion in cuts in Medicare, which are currently on the table.
Cuts in the private Medicare.
But Joe, it's huge. When people hear it, they think it's mostly a bad idea.
We should discuss what that really is.
But
The $500 billion in cuts is to cut something called Medicare Advantage, which is a subsidy to private insurance. It's a subsidy to private. No, it's a subsidy to private insurance companies to try to compete with Medicare because they can't compete with Medicare. And when people complain about a government-run health program, Lou, what they're complaining about is a program that's very like Medicare, which the Republicans now claim to be defending. So there's a very interesting contradiction in their position. On one hand, they're trying to save Medicare, that government-run program, and on the other hand, they don't want everybody else to get
benefits financially from getting rid of Medicare Advantage. So, I mean, there's a lot of hypocrisy to go around. But what about the idea? Well, because, I mean, I think that's one of the big groups that's pushing for this. But what about the idea of bipartisanship? I mean, Harry Reid and the Democrats had a Republican, Olympia Snowe. That would have given them cover to say that they were going to pass bipartisan health care bill. They've slapped her in the face. I mean, that is a very serious thing. They've essentially sold her down the road.
They've decided that she's wrong on the policy issue and that they don't need to cater to her to get one Republican vote.
Let me ask you this. Associated Press reports on the profits of healthcare insurance companies. A unique report over the weekend. The healthcare insurance companies have been vilified in this debate by this administration, by this president, by the Democratic leadership. About the onerous profits that they're enjoying. It turns out, according to the Associated Press survey of these companies, that they average 2.2% profits, ranked 35 out of 53 industries on the Fortune 500. Is there just the slightest possibility that the rhetoric has exceeded reality to the point that it can be a problem in moving forward?
I think if they covered pre-existing conditions, they would probably do a lot to kind of improve Americans' view of them. I think the kind of...
This isn't really what I'm asking you about the administration's problems in public relations, not that of the insurance companies, which have a major problem. They're being vilified by a sitting president with 2.2% profits, ranking 35th out of 53 industry groups in the Fortune 500.
Do they all have 2.2% profits?
I think they use the expression average, didn't they, Joe?
Right. So some of them are very large and have much higher profits.
But I think Democrats are on record saying that this industry has the highest profits of any industry, and in fact, they're 35th. I mean, that is not just...
I don't think the president ever said that.
I don't know. The president said it. I think Democrats are on record
huge boogeyman that they've been trying to vilify along the way, and the president has to stop being this tennis referee. He needs to jump into the game.
Stop vilifying and demonizing doctors. He's quit talking about ripping tonsils out of young children and amputating feet. That's to the good. Will we see a similar retreat when it comes to insurance companies?
Well, I think, they tried to get the insurance company to come in and make a deal where, for example, their monopoly...
Sounds like it's not going to lead to a direct response to my question.
That's the Chicago way. If you don't make a deal...
Thank you all so much. Appreciate it. Great having you with us, man. Thank you very much. Thank you. Joe, as always, thank you. Thank you very much, Conway. Up next, Republicans hoping to capitalize on conservative voter power and dissatisfaction with Democratic policies. What does that mean for one governor from the state of Texas, Governor Rick Perry? We'll find out here next.